Hi guys, welcome back to the channel. To all my existing viewers and subscribers, it's always good to have you back. If you're new here, I am Trudian, your resident doctor and immigration advisor, and today we're talking about something super important, and that is health care or health insurance, how to get health insurance here as an immigrant in the United States. I know it can be really confusing. I myself was confused, especially with all the different rules and terms. But don't worry, I'm breaking it down step by step. Whether you're here on a visa or a green card holder, or even if you're undocumented, and I know no one wants to be undocumented in this current immigration climate. So if you are though, I'm telling you, you can still get healthcare, or you can still get some insurance. So let's get into it. You might ask the question, why do you need health insurance? I'm from Jamaica, and oh yeah, probably wearing my Jamaican shirt. And we have a socialized healthcare system. Pretty much, hospitals are free. You get free healthcare. We abuse it as citizens, because as a doctor working in Jamaica, I know how much we abuse it. But healthcare was free. Here in the US, totally different. Healthcare is expensive, and when I say expensive, I mean really expensive. Like a simple ER visit can cost you thousands of dollars without insurance. My husband always say bankruptcy is like a surgery away. So that's why having health insurance here is not just helpful, but it's essential. It protects you from the high medical bills, and it gives you access to better care, because you go to the hospital right now, they're checking your vitals, but at the same time somebody's checking if you have insurance. So it is that important. Yes, you'll get care. They'll stabilize you, but they won't keep you for long if you don't have insurance. All right, who can get health insurance? Green card holders, of course. And remember, we're talking about immigrants here. So green card holders, if you're a refugee or you're here on asylum, you can get insurance. People on work visas, like your H-1B or student visas, F1, even you're on J1, you can get insurance. The DACA recipients, undocumented immigrants as well, but some options of course won't be available to you, and we'll talk about that a little later. There are different types of immigration status, and this gives you access to different insurance programs. So let's break down the different ways that you can get health insurance, and there are four main ways. And the first one, and I guess most people would have gotten it this way, and this is like through your job. So your employer, and in these situations you have to be working full-time for the most part, right? And it's called employer sponsored insurance. If you're working for a company that offers this type of insurance, they'll usually help pay part of the monthly cost. That's good. So this is one of the best options if it's available, and you need to ask your HR if you're eligible and how to sign up for this type of insurance. The second one that I'm going to talk about, I have my tablet here, made some notes, so just going through to make sure I don't miss anything. But the second one I want to talk about is the marketplace plans, and you get these at healthcare.gov. So if you're lawfully present here, so if you're a lawful immigrant, you can buy insurance from the federal or the state marketplace, and that's healthcare.gov. I'll leave the link here so you can check it out if you're one such person looking for insurance. Not for the undocumented though, you have to be lawfully present here in the United States. Many people will qualify for subsidies, and that's like discounts based on their income with this one. And even green card holders with less than 5 years in the US can apply. So you don't need to wait until you get to being here 5 years before you apply for the marketplace insurance. The next one is Medicaid and CHIP. And Medicaid is free or low cost insurance for people with low income, right? So you're basically getting some aid because your income might not be enough to cover. And this is available to green card holders who've lived here in the US for 5 years or more. So you have to be here over 5 years to qualify for the Medicaid. Refugees, persons on asylum, and certain visa holders may qualify immediately. The CHIP that I mentioned is Children's Health Insurance Program, and this covers kids regardless of their immigration status in some states. Some states like California and New York, they offer Medicaid to undocumented immigrants under certain conditions. The fourth and the final category that we'll be looking at is community clinics. And as the name suggests, these are like walk-in clinics, and I guess the undocumented would normally utilize this avenue a lot. So if you're undocumented or if you can't afford insurance whatsoever, you can still get care at community health centers or the clinics. And here in Missouri, clinics are like free or they're low cost, and they offer sliding scale payments. No insurance is required, and I know there are quite a few of these clinics in New York. I'm not sure what state you're in, but if you're an immigrant and you know about these clinics, leave it in the comment. Let us know if they're available in the states or in the cities that you're currently living in. So what are documents that you might need when you're applying for health insurance? You need to be ready to show your proof of income, your immigration documents, so like your green card, your visa, your work permit. You need to show your ID or your passport, and address and basic information. So last thing I want to look at, because I don't want to make this video too long, but we can check out the tips and the resources. So there's this link called the Healthcare Navigators. It gives you free help to guide you through enrollment. You can visit like the local immigrant organizations. Many offer healthcare assistance, right? And healthcare.gov that I mentioned earlier, you can do so for. You can check that out for more details, especially if you're not English speaking. They have information readily available in multiple different languages, so that's a good resource to check out as well. And I do hope this video helped you to understand your options a little better. If you found this video useful, give it a thumbs up, share it with someone who needs it, and don't forget to subscribe for more helpful content for immigrants in the US. If you have any questions, please drop them here in the comments and let me know what topics you'd like me to create videos for or about. I always try to reply. Until next time, stay healthy and take care.